Yes, guys, today is on Friday. On Friday, the week has been so long, so long. And we've done so many things since we started streaming live and talking about mental health. So I kind of like today, we need to have a talk on experience. Experiences that people have had. We need to have a talk on the experiences that people had through the week, things that the people have been on and through, and we share ideas. Of course, sharing ideas is the most important thing when it comes to mental health and social relationship. So, if we go through the topics that we have been covered right now, the topics that we have covered are many, and we have covered so many things in a few days. A few days. Mhm. And so many people have got help, and I feel nice. I feel nice when yeah, very important. We discuss issues that we've covered. Very many issues we've covered. I'll go through. Like yesterday, we had a topic on social support that came late. Some people told me, no, you need to know what you mean by social support when it comes to mental health. We have covered so many things like bipolar complications. We have covered schizophrenia. These are things that happen. You may find that one thing will at least get you or get someone else. Yes, Lawino, hey, welcome. It's a recap of the week. Just interacting because we have covered so many things. At times, we need to recap and know if someone has a live question, it's important that person to bring it out so that we discuss and know, and we go on, and I'm setting things up so that people should see. Yes, that way. Now we have like um, uh, let's go to see the topics that we have covered. We have covered personality disorders, sexual dysfunctions. Sexual dysfunctions are so very big topic, and people when we were doing sexual dysfunctions, um, when we were doing this topic, people were surprised that we were having so many things. The things that people knew they are small issues, they came to realize that these are small issues. There are big issues in life, and they need to be sorted the way they need to be sorted. Basal ganglia, you see, when we were talking about the brain, we talked about basal ganglia and how the brain works. Mhm. We talked about premenstrual dysphoric disorder, premenstrual dysphoric disorder, and pain physiology in menstruation. How pain comes in women when they're undergoing their monthly. You get it? We talked about it, and it was a good interaction. And I know that video has helped so many people to know how to cope when it comes to monthly periods, and the pain, when the pain comes, how to handle the pain. Some women get depression when they are in the monthly periods, and I think I helped someone. According to the email addresses, I think I helped someone, and now they can talk to their doctor. They know what to do. We talked about how the human brain works, the parts of the brain, how they relate to your body, how we even the neurotransmitters. Remember, we talked about depression, hmm? Major depressive disorder, and we saw there are several types of depressive disorders. You see, very important. So people didn't know how to cope with the depressive disorder. But when we talked about depressive disorder, it helped people to know, and know it will help people because most people are continuing to 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 view the videos and appreciate. We talked about persistent depressive disorder and disruptive mood dysregulation. That is a topic of its own, and people appreciated what we talked about. We go on the recap of the week. Overview of mental health. We introduced mental health, and you see there are some diseases we talked about like Alzheimer's disease, and more Alzheimer's disease and more like HIV. They relate when it comes to mental health, and they are a great deal when it comes to mental health. But you see, those are big topics that needs a day. Something like HIV is a big topic that needs a day that we need to sit down and discuss it. Even Alzheimer's disease, like just yesterday we talked about uh, uh, the previous day. That's like we talked about uh, um, what we called bipolar disorder. You see, question and answer. Let me write this. Uh, Let me write here caps question and interaction. Interaction. Question and interaction. Like that. You see? So there are some things that are helping, and they are very important when it comes to human life. You see, he, it is important to interact, and we know what we are dealing with and what we are having in our lives. Issues that relate to life is very important issues. Developmental milestones. It's very important for people to know how their milestones are. Oh, sorry. They are very busy week, and it's a Friday. I know so many people Fridays they are leaned back on their going to relax at home on weekends and relieving some stress. You get it? So the interaction today is just if someone has a question and anything that this person can ask, should ask. We saw a word like ethics. Let's see. When we talk about ethics, you see, mental health is ethical. Ethical and vices are related. So when you talk about ethics, how are they related to mental health? You get it? Empathy. Someone yesterday asked me, so empathy is a big word. Hmm? And you see, it's a big word when you really think about empathy, empathetical. Hmm? When you think about empathy, you're thinking about, we talked about cognitive empathy, emotional empathy, compassionate empathy, and you see, we even talked about importance of empathy. Importance of empathy. What is the importance? We're still interacting about empathy. Those are little words that people speak about, but in real sense, they are big words. When you come and relate to it, you find that it's a big word. You see, centers like when you talk about cognitive measures and issues, those are issues. They are words that you may feel is just a light word, but when you think deeper inside them, they talk about a lot of things. You see, like yesterday, we learned that we have three types of empathy and the importance of empathy, like building trust, promoting help behavior, and kindness, essential in profession like healthcare. Promotes behavior, enhances communication, and reduces conflicts. Empathy. We talked about them yesterday. We said there is a word that people uses always when it comes to mental health. A word like logic, logic. See, logic is a big word. Logic is a big topic. But you see, we take it lightly. You tell someone you are not thinking logically. What do you really understand by the word logic? You see, logic is the systematic study of reasoning and valid inference. You get it? And valid inference, it helps to it helps us to determine whether an argument or conclusion is correct or set of premises of facts. You get it? So these are words that we use daily in life, but at times we really don't know how to, to put them on on to place, on how to make them, and to make people understand it clearly. We have just talked about logic. When we will be talking about logic, in medical school, we talked about there is a unit we learnt about it. It's called critical thinking. Critical thinking. So when we talked about it, we studied something called logic as a unit, and we saw that time that there are several types of logic, like deductive logic, inductive logic, and abductive logic. So when you are telling someone you're not thinking logically, know that you are using a big word. Be careful, use it well, because what is deductive logic? Move from general principles to specific conclusions. You get it? And then there is inductive logic, induced logic. Inductive moves from specific observation to general conclusion. You see, from general principles to specific conclusions, from specific observations to general conclusions. You see how they play around. Yes, and then we go to abductive logic. Abductive logic. Abductive logic involves making best possible explanation for the available evidence. You get it? Very important. Very important when it comes to thinking and talking on in mental health. And you remember we talked about mental health, and we specified some problems that people go through when it comes to mental health. And so today, if anyone comes online, I'm here to 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 answer question and have a recap of the week. Although Friday is a busy day, people are tired. They want to go and relax. They want to do a social relationship. You get interaction, things like that. Mhm. Or so that is it of the week. So that is how things go on and how things relate in mental health. I'm very sure people are learning, and they know what mental health is right now. Although, as we started with mental health, but We are going, and we start digging deep in specific issues that even they don't relate to mental health. We'll dig deep to specific things that we really want to know. You see, mental health all means uh, mental health means pertaining to mind or cognitive process such as thinking, memory, emotion, reasoning, and perception. That is mental health. So we check here and we see cognitive issues. What are cognitive issues? What are cognitive issues? We see cognitive measures. Hmm? What do we think of when we talk about cognitive measures? Because we have talked about this thing for so long, and at times it's good to come clear with some words and know what these words mean. Like cognitive measures, what do this word mean? Cognitive measures refers to assessment or tools used to evaluate and an individual mental functions, include how they think, learn, remember, and solve problems. Their measures are used in psychology, education, and clinical settings to understand cognitive strength and weakness. So it is a tool, or it is something that we look at someone and we conclude how this person think, remember, and solve problems. These measures are often in psychology, education, and clinical settings. You see, they get into some multi-sectoral farms and even places that they are used away from the clinical setting or the medical setting. You see, there are common examples like intelligent tests, memory tests, attention, eh, attention and concentration tests. You get it? Execution function test, language and verbal fluency tests. Those are the tools that are used. Processing speed tests, visual, spatial, and motor skills. Motor skills that we say it is about muscle. Diagnosis identifies cognitive impairment, intervention planning. You see, importance of cognitive measures. It helps in diagnosis of some problems, intervention and planning. You see, research, very important, tracking progress. You get it. Those are the main things when it comes to 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 cognitive. You see, very important, very important, very important. So today is a recap of just live. Someone is passing by to ask me a question. I'll appreciate, and we go on, and life becomes better and better and better and better. You get it. Mm? So cognitive issues are always everywhere. Mm? Mm. Yes. So sorry. Um that was a call from someone. I have to reply. So that is it, guys. That is it. That is it. Very important messages from mental health. I know some people have got some help in whatever they are doing, in whatever they are going through. But no, mm, mental health is something that is very diverse. We don't just think about the problems, uh, we should think about the common interaction that we interact with people out there. Because the way we interact with people means a lot. The way we talk to people means a lot. The way you bring up your children means a lot. You see, there are some things that in life you can lose because of the way you talk, communication skills. You see, communication skills is an important matter when it comes to uh, mental health. Mm. Because you may lack the communication skill that uh, people prefer the best. You are a good person, but your communication skills are bad. You may lose some things in life, like verbal communication. You see, the way you express your words in tone and even clarity of your words, and sometimes even volume and word choices. The choices of words that you choose for communicating is very important. Very important. Hmm? When you are with people, why do you get problems always when you are with people? You see, these are the things that you should ask yourself. And then there is nonverbal communication, in facial expressions, gestures, postures, eye contact, eh, and body language, often conveys attitude. See, you can get to a place and then people look at you and they have already read your attitude because it's verbal. Communication does not mean that the words you use only. Non-verbal words are the gestures you use to communicate. Mm. The gestures you use, how you respond to words non-verbal. You get it? The posture. You get somewhere you are in at an important meeting and you want to sit like you are in your sitting room or outside eating guavas. No. The body language is very important. See, modes of communication, like written communication, like expressing ideas through writing, emails, reports, and texts. You get it? This is very important. We have the grammar you use, the structure of your sentences in words, how you cooperate, you attach every word in written communication. And you see, in communication, it's not only the communication only. There is something like listening. Do you listen before you respond, or you're that person that before you told something, you have already answered? Listening is a very important thing in communication skills. Listening, having a listening ear, very important. Having a listening ear, hmm? Fully concentrating, understanding, get it, responding, and remembering what is it one says, involving involves giving back and avoiding interruptions. You see, listening is very important. There are some people who don't listen. When you start talking, they have already started answering you. They have not even, you have not finished the statement. Hmm? So listening here is very important. And then there is visual communication, use of visual elements like charts, diagrams. You see, this one now comes to when it comes to professional skills like when it comes to you need to present something, data, ideas that you have. Those people that do masters and when you are at degree level and then you are told to do a research, the visual communication you will see like charts and pictures and diagrams. Those are visual communication, important in teaching and designs. Yeah. And instead of telling us so many words, you present them on a chart. Immediately I see that chart, I see the graph, I already know what is happening. Mm. You see, very important. Mm. You see, very important, very important. So those are things that we look at, and then we know our mental state. But you see, sometimes you may the way a person talks, you may judge this person, the mental state of this person. See, very important to sometimes um, look at how things are and how things are going. The, and in communication skills, we have the key components because how a person communicates is how a person uh, behaves. Mm? It signifies the mental state of this person. Mm? You see? So here in communication skills, we should really think because there are some key components in communication. The key components in communication. You see, we will look at you the way you behave. We have talked about the types of communication like visual communication, listening skills, written communication, and non-verbal communication in like the gestures, the postures, the eye contact, body language, facial expression, verbal communication, or how you talk. And then we know this person has a problem. So it is very important when we talk about communication in mental health because it is sorry, I'm talking as I'm answering some text here. It is important we know how to communicate. Mhm. Ron, you see, so your communication skills, I think we need to have a topic whereby we are teaching people on how to have communication skills. It is very important. If people think the verbal communication is the only communication we render in life, no. As you're watching, please like as we go on, like the video, and as we go on, at least someone will see it somewhere. Yeah. And then you see the communication that we think is verbal is not the communication that helps people. In mental health, we look everything, the body skills, the gestures you have, writings, how you present your work for intellectuals and those that are in school. When you are not doing your assignments or works well on paper, we will start noticing that there is this person who is doing good, but there is a problem. Yes, Michael M. Welcome to the platform. We are talking about the communication skills. And so today we have learned that it is not only verbal communication and verbal communication written. We have more types of communication. And the key components in communication are key components in a good communication skill. We have clarity, confidence, empathy, feedback, adaptability, and respectfulness. A person who has a good communication skills, a person who has good communication skills will be clear with the words, clear and conscious message delivery. You see that? Hmm? A person who has good communication skill with good mental health will have confidence in what this person is delivering, like expressing oneself, assertiveness, and respectfulness. You get it? And then we have empathy. Yesterday we talked about empathy. Empathy is a big word. Empathy, understanding and respecting others' feelings and viewpoints. You understand and respect other feelings, viewpoints. You get it? It's very important. And then we went to feedback. How do you give and receive constructive responses? Hmm? When you have children at home, how do you interact with them? You see, at times, parents, we make our children not to have good communication skills, and then you blame them or you blame the other partner that you are the problem. No, it is because you yourself, as a parent, the communication skills are not clear and good. Respect. It is very important when you are talking to anyone to have respect, being polite, professional, and culture sensitive. Very important. Even the children that you have, respect them. Let them grow knowing that our parents are respectful. So we should learn from my parent because he or she is my role model. Hmm? Call your kids around, talk to them. Stop saying they are your children and you are the rule. No, communication skills. Kids and children learn from you. They will want to behave like you when they grow up. You see, there are so many importance of communication skills like build better relationship. Yeah, yes, because of the respect, you build good relationship. It enhances teamwork and collaboration. Because when you have respect between groups, there is teamwork and collaboration. Because no one will want to work with a person who is arrogant. You get it? But even we can find that support effective leadership and conflict resolution. How you solve your conflict. Let's one day, because we are dealing with mental health, let's one day interact on how we bring a topic called conflict resolution. Just like we've said logic, we are bringing it. Yesterday we had empathy. Empathy is a big word. There are some words that people use and think they are just words. No, they are not words. They have bigger and heavy weight in them. Hmm? Improves academic and career success for those that are in their careers. When you have good communication skills, it improves your career success, helps in mental health support and intelligence. Good communication skills. These are things that we really need to understand, to know, to capture them, and walk through them so that we can have better and good life and good social life. Hmm? So you now know that mental health is not just mental health. Mental health is a very big topic, very big topic. Not even in diseases. There are some normal things in mental health, normal things that we look at them and we see these are just normal things that are. Let me say, if you go to a society that no, let me take this one. There is a couple. Both of them drink alcohol. They fight in their house, and then tomorrow morning they are very good walking, discussing how they fought each other in the house yesterday. But there is this couple that were brought up, even a slap is a taboo. You cannot think about a slap. You see, both of these marriages are forms of marriage. One has very negative perspective, but the other one has a positive perspective. When you go to solve issues to the other ones who fight and discuss how they fought, you will not start talking to them like the other couple. But you see, both of them are relationships. And you see, this other couple will grow out from this fighting because as they grow up, they come and leave some things. They stop some things, doing some things that are like fighting and doing so. So it is very important to talk about mental health. It is very important to discuss this. It is very important to talk to our communities about this. There is a social perspective that comes in, the cultural perspective that comes when it comes to mental health. We will discuss about it, and we will know how to work on it. Today was a short time discussion, and this discussion was just for asking questions and discussing and the recap of the day. So issues concerning mental health are wide. We have seen that, and I would like and urge people: don't uh, be with your problems. Always come out clear. Talk to someone and discuss. And I'm seeing my time is getting out, and we have talked for at least 40 minutes. It's going to 40 minutes, and I would really love to receive those messages that I usually receive. Uh, those messages that I receive daily in my emails, everywhere, discussions, talking, and the way we learn. Even when you are there learning with me as we go on, let's be ambassadors of peace. Let's be ambassadors of good culture. Let's be ambassadors of good interaction. You get it? Let's not be ambassadors of distraction. Hmm? The world is ours. We need to live well, and people are dying before because of mental health. And it's good we talk and discuss these things. So for today, I think the time is good. Today it was just a recap. Next week I will post the topics, and as usual, as I say, if you really have a topic that is pressing, email me. Like yesterday, when we brought up a topic, email me. Let me put it down, structure it, so that we know what to do with the topic. You see? Mm. Okay, okay, okay. Be blessed, everyone who has watched. We'll meet next week. But my email is open. Everyone has my email, and we will do something. Good day.